All right, healthcare reform. Not a huge number of changes that we didn't know about here. So this is changes that are actually for the 2016 year that people dealing with reporting this out will see when they're reporting in 2017, early 2017. So just recap, who does this affect? This is for organizations with 50 or more full-time equivalent employees. If you aren't sure about the full-time equivalent employees, that's the calculation there. Put that in just so you would have it for later reference. If it does apply to you, here is what you need to be doing. You need to be providing minimum essential coverage, and that's kind of that defined term by the benefit plans, at an affordable rate. And that affordable rate is a set percentage, can't be more than a set percentage of the household income, and then there are some safe harbors for that I will get into, and to essentially all full-time employees. And so a couple of changes here. One, the affordable rate, and what started out at 9.5%, and it's now 9.66% for the 2016 year. And then all full-time employees, there was some transitional relief so that for organizations, all full-time employees for the last year or so has meant 70%, and this year it jumps up to 95%. So that was just kind of that easing people into it. And then, of course, the biggest one, the penalty relief for organizations 50 to 99 is gone in 2016 as well for that 2017 reporting. So now it's the rules as they were intended. There was this transitional relief that was kind of layered on top of it, and most of that has gone away. So I have that there, and then there's one change in terms of how the penalty is calculated that makes one of the penalties a little bit more harsh as well on that. And I could spend a lot more time on this, but I want to get to a few of the other things that we have, so unless there's any burning questions. I did put here the deadlines for reporting. There was an extension last year. We have not seen that there's going to be an extension this year, so don't plan on it. As far as reporting changes themselves, they've released the draft forms, and a lot of the things are the same. There are a couple of new codes. I don't know if any of you are the ones actually filling out the forms. There's 1J and 1K, which are conditional offer codes, so just something to be aware of. We answer a ton of questions about this come reporting season, so if you get caught with anything, Mammoth is always there to help. A few other upcoming changes that I did want to bring up. The whistleblower expansion for nonprofits. If you are a 501c3 organization and you receive any public funds by grant or contract, and that's not particularly well defined as I understand it, so I think it's best to assume that if you're receiving any funds from public sources, it applies to you. Is that kind of what NAO is saying?
That's the line I wrote.
Okay.
Spent a lot of time on this one.
Like in-kind income from those contracts, if it's not cash income, if it's not like if you receive a whole bunch of computers from the county, for example, that's in-kind contribution to the organization.
Jim, do you have
I would always err on the side of caution. I mean, we believe every nonprofit should have a whistleblower policy. What our concern was with this is that the state was mandating it and now regulating it, and they extended it to board members, which creates for us, we believe, a duty of loyalty issue for those people. They already have a requirement through the Department of Justice that a board member is supposed to have a duty of loyalty, but now they've expanded whistleblower policy to include, and that you have to educate them every year, and that you have to document this, but none of it is clarified in the law, so it's unclear how the regulation will, the rulemaking will actually look on this.
Yeah.
Sorry.
That pretty much says it all, so unless there's any objections, I'll move on. We think it's best practice as well to go ahead and that everyone really should have a policy, and I know that NAO has a sample policy.
Yeah, we have a sample policy, happy to provide that to anybody.
So
can you speak to the annual education?
Yeah,
I mean, so we have a policy, those new employees, but every year we're supposed to.
every year you're supposed to make aware your your employees of their rights to whistleblow. Yeah. And provide a process for that. And that's what's really, what we didn't like about this law is it didn't clarify a lot of that, you know, the how.
And that's specific to C3s?
That is specific to C3s that receive money in some way through public funds. That was the big piece we were able to cut out, was it was going to be all C3s.
So this is to whistleblower, possible ethical,
Yes.
like favors being traded or some
Ye-
concerns about that between the public sector and.
Any state or federal law violations
Right.
that you have an employee who
Suspects wrongdoing.
suspects, you know, reasonably suspects wrongdoing, and actually lawfully obtains information or documents about that, and then reports that to specific people. So there are a few specifications there, but on the front end, it's just the important part is having that policy in place. So OSHA, a couple of things, so a couple of odds and ends here to wrap up on what is coming. November 2016, just around the corner. This was actually supposed to be effective this summer and was delayed until November. Employers must inform employees of their right to report work-related injuries and illnesses without retaliation and have a procedure for that reporting that does not deter or discourage reporting. Also have to provide access to injury and illness records and not retaliate. The big piece of this is that not deterring or discouraging reporting, OSHA has come out and said that their interpretation of that is you shouldn't have incentives for keeping the injury and illness rate low. I think that's been conventional wisdom for a while now. The big one is automatic post-incident drug testing may be a deterrent to reporting accidents or injuries. So what we have kind of gone to saying is you should be looking at your drug and alcohol policy, and if you have things in there that says there will be testing after every accident, you probably need to look at changing that. A lot of organizations that we're working with are just going more to the reasonable suspicion testing language, and not having that anytime there's an incident, there will be drug testing. The idea, kind of what OSHA says is, well, if you have someone who, you know, slips and falls and hurts themselves and knows they're going to be drug tested if they report that, they may not report that, even though nobody would actually think that it was caused by, you know, intoxication in that particular instance. So that's where they see the potential deterrent. So just be aware of that. Take a look at your drug and alcohol policies. Also with OSHA, there is some electronic reporting changes coming up. This is for the Form 300, 300A, and 301, for those of you who are required to do those. For large employers, there's slightly different time frames for large employers. The 300A has to be reported electronically this July 1st, and then the 300, 300A, and 301 all have to be reported electronically starting in 2018. For employers between 20 and 249, there is now a separate list of high-risk industries, and only those on the high-risk industry list will be required to report electronically. And those on that list, again, it is for 2017, in 2018 by July 1st, and then moves to March 1st after that. So if you are currently doing 300 logs and 300A reporting, posting just something to look into for reporting next year. All right, this one is my last one for what's coming up, and this is just within the last week. They finalized this rule. It's a bit down the road, so probably no need to do anything today about it, but for employers who are filling out the EEO-1, so 100 or more employees or 50 or more federal contracts, going to have to start reporting W-2 earnings, and that's going to be for the 2017 reporting period, but they're extending that reporting to 2018 to March 31st of 2018. So you do have a little bit extra time, and that's going to be every year that it's actually extended. So that September 30th date is now going to be the next March. So there is time, but just know that that's coming. And before I leave, a couple of things on the horizon. Don't need to do anything about them yet, but could be coming our way. Pay equity laws. We've seen some states and municipalities starting to go there in terms of same wages for comparable work, and then also not asking about salary history on applications or in interviews. And we recommend that people don't do that just as a best practice anyway. It does generally kind of further pay disparity issues, and so we don't think it's a great practice anyway, but that could be coming at some point. Medical marijuana accommodation in Oregon for medical and for recreational use. Employers can say no, absolutely not, make their policies whatever they want them to be. There are some states that with medical marijuana use do have written in that employers will need to do some accommodation. There's not been a lot of lawsuits on this in states with that specific language. We don't know where that's going to net out, but it would not surprise me if in the next 5 or 10 years we start to see more statutes where the employer does have an obligation to make accommodations for medical marijuana use. And then a few other issues to keep your eye on here. National paid sick leave, minimum wage. Watch the political issues for that in terms of whether there's any chance of that happening. Credit history limits, commuter benefits are ones that we've seen in other municipalities and states that have a chance of coming this direction as well. And then one that did not make it on all of my slides was there is a new I-9 form that will be coming out probably in the next month. You can continue to use the current one, which says it expired last spring, until next spring, sometime in January or February, I think. And then you will be required to use the one that is coming out shortly. So that is it, and I'm not as over time as I thought I might be. So thank you all, and I'll stick around for a couple of minutes afterwards if any